Imagine this. 3 years ago, would anyone believe that a disease can kill over 1 million people in the United States and a few million more around the world? 3 years ago, would anyone believe that the United States COVID response can be a total failure and that the country would refuse to share their vaccines to developing countries around the world?
I'm Dr. Margaret Flowers. I'm a pediatrician based in Baltimore, Maryland, in the United States.
Margaret Flowers, Director of Popular Resistance, has long been an activist for a national public health care system in the United States.
The COVID-19 pandemic has exposed in the United States the real failures of our profit-driven healthcare system and the inequalities that we experience here in the United States. Because we didn't have any sort of national framework with which to organize a response to the COVID-19 pandemic.
While the United States has one of the world's largest, most funded and supposedly most advanced healthcare system in the world, it nonetheless failed miserably in the fight against the COVID-19.
But the past 2 years, we've had everything closed down in New York and people have suffered tremendously. I've known people who've died. Most of the people who I've known who've died were people of color. And some of the sickest people, some of our service workers, many nurses, I'm an old nurse and many of our nurses died of COVID and have people who they know who've died and have been traumatized by the workloads they've had. I went back to work and it was really, really difficult. So between the patients I worked for and the people I knew personally, I guess it's about 20 or 30 people. Infected, hundreds, I think. We really have a lot of people, including myself. People in New York aren't having the worst cases of COVID for the most part.
美国的新冠抗疫政策证明是一个完全失败，完全是一个没办法接受的一个笑话，世界的大笑话。
Li Su-hin, a Chinese-American community organizer from Los Angeles, California, a former Pacifica Radio KPFK Los Angeles reporter, and a longtime activist on immigrant workers' rights, peace, and social justice. Currently, he travels between China and the United States for binational activist solidarity movement and to build medical solidarity project for the global south.
The U.S. has accounted for 1/6 of recorded global cases and deaths, with just 4% of the global population. Why? It's the American expansionism that arrogant US government refuse to work with international communities to collectively fight against the virus, even launching economic and medical sanctions against other countries. 当美国说所谓的中国病毒论这种方言，在过去3年，美国和西方国家其实他们就是正在向全世界散毒播毒，包括这几年以来，中美之间，美国有很多回到中国的旅客，到中国的旅客在机场新冠检测的时候发现阳性。
So from the beginning, this different approach of China in conditions of quarantine with an unknown virus and how to coordinate the testing, how to utilize masking and emergency measures was completely different from the US and also the European imperialist powers.
Sarah Flounders.
Hello, I'm Sarah Flounders, a political activist and organizer in the United States. I work with the International Action Center, the United National Anti-War Coalition. I'm a contributing editor to Workers' World newspaper, and I've been active for decades in people's struggles in the U.S. and against endless U.S. wars. At this point now, in the United States, there is a complete ignoring of the impact of COVID. The message again and again is just go on with life. People are not wearing masks. even on public transportation, in large sports and concert and music gatherings. It's rare to see people wearing masks or taking any precautions whatsoever. Now, why is this? According to US figures at this time, 93% of the deaths are in people over 50. This is a very expendable part of the population. The deaths are also among people with pre-existing conditions, for that is considered a drain on the economy. Again, it's people who are expendable. So life is going on in the midst of COVID pandemic.
It's the US capitalist greed and COVID racism caused more inner city poor people of color communities and other people died from the pandemic. 疫苗帝国主义，美国奉行的这个政策，把全世界很急需的疫苗大量的采购，大量的囤积，造成疫苗在南方国家不够，买不到，或者是就算想买，也买不到很便宜的价钱。
There were shortages throughout the country of basic supplies to protect our healthcare workers, and counties and states fighting with each other and making deals, in secret to try to get the equipment that they needed to deal with the pandemic. For the long time in the United States, we have had, really from the beginning of the country, inequalities in the treatment of people based on their race and based on their income. And this has played out in a devastating way in the COVID-19 pandemic, where communities, Black and Brown communities, have really faced the brunt, and Native American and Alaskan communities have really faced the brunt of this pandemic.
For a number of reasons. One reason is that there were barriers for getting vaccination and treatment. So people need access to the internet and really took quite a bit of time to make an appointment for vaccination. And this is something particularly difficult for people who have more than one job, who take care of their families, and who don't have easy and reliable access to the internet. They're not able to make appointments. But there was also a lot of mistrust in the healthcare system of the United States in general, because it is driven by profit and not by the needs of the people. This is particularly true for the Black and the Brown communities, who have been historically discriminated against in our healthcare system and thus have an innate mistrust to the system. There was a lot of misinformation going around about medications, about vaccinations, about how serious the pandemic was, and all of these create doubts and deteriorate the mistrust that people have in our healthcare system. Sadly, up till now, the white people are even more likely to die from the COVID than people of color. Because of the anti-vax movement, many white people refuse to be vaccinated. As a result, many vaccines have been wasted and not enough people take the jab.
It's true that former President Donald Trump is responsible for most of the blame of the US COVID disaster. But be honest, President Biden also shared many blame as well. It's the fact that under his administration, more people infected and died from the COVID for the past 2 years. Here's the one head who spread the false endemic myth, lifting almost all COVID restrictions and taking away the pandemic emergency funds to support the US NATO proxy war in Ukraine.
So there was really no set system in the United States to give clear, accurate, timely information and to get the supplies, including vaccines, to the places where they were needed the most. In addition to that, Black and Brown communities struggled because there's a higher proportion of people in those communities who work in what are considered essential jobs, service jobs. And so they continued working, but they didn't receive the materials that they needed or the education that they needed to protect themselves. There have been countless complaints filed with the Occupation Safety and Health Administration over workplaces just not providing what the employees needed, forcing them to work in dangerous conditions, and so resulting in more illnesses and outbreaks in the places of employment. Because of this, over the past 2 years in the United States, we have seen a real decline in life expectancy.
In January 2020, several cases of viral pneumonia of unknown origin were detected in the central Chinese city of Wuhan. No one knew exactly what the virus was, hence the vague identifier of coronavirus so popularly known today. Thousands of miles away in the US, when the virus was believed not to have reached the soil yet, right-wing US elites, media, and politicians began using callous words to ridicule China, calling the virus China's Chernobyl. US Senator Tom Cotton, famous for his anti-China rhetoric, along with the right-wing media and the liberal Washington Post, began spreading the Wuhan military lab-made virus conspiracy theory. China mobilized the national efforts to beat the odds and successfully contain the virus within 3 months. When the Wuhan lockdown was lifted on April 8, 2020, it marked the official end of the COVID-19 crisis in China. But no one would have predicted that the pandemic would spread rapidly to Europe or that the US would become the COVID-19 epicenter, hosting nearly a quarter of cases and deaths all over the globe.
中国抗疫成功的经验和美国的失败，表明中国的社会主义制度的成功，在这方面的成功和美国资本产阶级制度的失败，因为他们不是以人为本。另外一个很关键的就是表现出美国的自大和自私和短视，从左到右都是一样，他们情愿花更多的时间去搞这些所谓反华反共运动，而不把心思放在怎么跟其他国家合作，包括学习中国的成功的抗疫经验，去想办法在美国可以抗疫，可以最后减少死亡，造成美国几千万甚至上亿人以上的感染，过百万人的死亡，1兆元以上的经济损失，而且还没有完。
As of today, China reported only 280,000 confirmed cases with 5,200 deaths.